Welcome to the Muslim Mind Collaborative podcast episode for World Alzheimer's Day, an opportunity to educate and encourage support in our efforts to demystify dementia. There has been an eightfold increase of dementia in ethnic communities across the UK, and people from ethnic minority backgrounds are at greater risk of experiencing dementia and at a much younger age. Dementia costs 32 billion a year in the UK, as reported by Myriade. Kate Lee, the chief executive of Alzheimer's Society, said that South Asian people were expected to see a 600% increase in dementia diagnosed by 2050, compared with 100% in the general UK population. This podcast episode invites service providers, academics, and professionals to share research, specialist knowledge, and Muslim community experiences on Alzheimer's disease. In this episode, we explore how faith and religious practice may support prevention and help manage the condition through routine, connection, and familiarity. Exploring how support services and multilingual resources have improved awareness and service outreach in areas where there are high concentrations of Muslim populations. And finally, we explore the experiences of family members and carers living with dementia patients, what culture and faith-sensitive approaches have meant to those receiving support. We're joined by our guests, Mohammed Raouf, who is the founder and director of Myriade Community Interest Company based in Bradford. The organisation aims to support BAME communities living with dementia and service providers to embed cultural competency in practice. Mohammed is currently completing his PhD studies on how South Asian family carers cope with the transitions associated with looking after a relative with dementia. He was awarded an MBE from the Queen in recognition of his efforts for services to people with dementia and their carers. Louise Buckingham has worked for Alzheimer's Society in Luton, Bedfordshire as a dementia support worker since 2015. She founded the Luton Younger Onset Dementia Group and the Dementia Cafe. She has worked in partnership with statutory services and local organisations to raise awareness of dementia, and has collaborated with the NHS services to give information and support to people affected by dementia and their carers. Khalida Haq, who is a counsellor therapist with years of experiences in clinical and managerial experience. Alongside her independent practice, she was one of the establishers of Nora's counselling services in 2011, having recognised the scale of the problem of domestic violence in the Muslim community. She was previously counselling service manager across primary schools in Tower Hamlets and currently holds a senior managerial position and works as a clinical service manager with Mind in Hackney. Welcome to all our guests. What do we understand or know about dementia and Alzheimer's in BAME and Muslim communities? What are your experiences and insights as professionals and perhaps as carers? And why are we seeing a rising and disproportionate number of dementia patients in South Asian communities? Louise, if I can please start with yourself.
Yes, well, I think the main issue is that with dementia in BAME communities, there is an issue in terms of diagnosis at an earlier stage. I've noticed as a dementia support worker that a lot of the BAME families that I go to, particularly in South Asian communities, the dementia has progressed to a more advanced stage, which obviously is far more stressful for the families involved because diagnosis and the symptoms were missed earlier on. There is many people still believe that dementia is a natural part of aging. And so when symptoms appear, such as short-term memory loss, or perhaps the person is, perhaps walking around more, communication becoming more difficult, it's put down to the aging process, and particularly a lot of the, in a grandparent, for example. And also there's this belief that the family should look after their own members, and that there's at times sort of an unwillingness to approach other agencies for support. So one of the things that certainly the local Alzheimer's Society in Luton have been working on is to look at ways of trying to give information to BAME communities that will help with an earlier diagnosis, because we know that through an earlier diagnosis, it is more empowering. the families know what they're dealing with, the individuals can perhaps be helped with medication, cognitive medication. And so one of the areas, although we've done lots of events in trying to reach BAME communities before, it came to me sort of about 4 or 5 months ago. We never had actually worked alongside, for example, mosque to actually give that information. And so I sort of set about actually trying to make contact with some mosques in Luton. And Berry Park Mosque was Mr. Hussein, was instantly, very welcoming and said, yes, I want to discuss this. Because when I met with him at the mosque, he actually was giving me examples where there were people within his mosque that were coming to him asking for advice on how they should care for a member of their family. And, obviously they weren't aware or were unwilling maybe to contact other agencies, other organisations, or a charity like Alzheimer's Society to find out more information and support. And so he put me in touch with their well-being sort of section of the mosque, Justin Khan actually. And together we worked at actually hosting an event at the mosque that was backed by the mosque and promoted by the mosque as well. And so the week before that we actually had the event, it was actually announced at Friday prayers. Mr. Hussein made sure, to encourage as many people as possible to attend. And, we had a very good response. But I think we would not have had that response had it not been in conjunction with the mosque, because I've done, in our work with BAME communities and the Alzheimer's Society, we've worked with South Asian carers groups in Luton. We've also, I've worked at CYCD, the wellbeing groups for the Bengali community. But I think that, and also we've done some work with the Hindu temples as well. But I think we have not previously gone down that route of actually working in conjunction with the mosque. And that's what made the difference. And also I was able to bring around service users who perhaps, had only fleetingly had some contact with us and said, well, we're putting on this dementia awareness event, would you like to come along? And because it was being held at the mosque, they had that installed confidence and something that they wanted to get involved with. And the interesting thing for me when I actually gave the talk, and Mr. Hussein actually translated for me, was there were lots of questions, because you hit on that important factor that South Asian communities, apart from having more risk factors with dementia, particularly in terms of young onset dementia, there is increased risk as well. And there were lots of questions around risk factors and things like, does stress play a part in things? And just be able to go over, the fact that obviously certain health conditions like strokes and heart disease, for example, very high blood pressure, can increase those risks. And then to look at, with the wellbeing agencies involved, ways of actually helping people to reduce those risks, along with some translated documents and fact sheets as well, and just to make people aware of where further support can be obtained. I think all those things was very, enlightening for people. And now we've got that connection, which is very important moving forward. When people from that mosque, and hopefully, we can work with other mosques in the community as well, now go for support, for a family member with dementia or possibly with the signs of dementia, they can now be signposted to the Alzheimer's Society and hopefully, look towards having an earlier diagnosis, which is very important, obviously, moving forward for both the person affected by the dementia and the family.
I think that's really key, and it's really refreshing to see that services are actually being quite proactive in reaching out to local community groups, but also faith organizations and institutes. And this is really a great example to see how you've been able to not only raise awareness, disseminate some of this information, but really connect with other services and create that wholesome and very localized engagement. And I think it certainly does speak to a lot of the mainstream services, because I think sometimes there's almost this kind of mammoth a task ahead of us when we look at how we can get organizations in terms of their national outreach to engage with Muslim communities. And where for us as Muslims, it's an obvious place to look at places like a mosque and community centers. It can sometimes be very difficult when you look at it on a national level, but I think it speaks to certainly the importance and why we should be working quite closely with local services as being those kind of outreach components in that, and very much in being able to also pick up on some of the trends and the needs of local communities, which is really significant. I mean, Mohammed, you've looked to set up Familiarity in many ways to again reach out to South Asian communities, and for you to have developed some of the resources and the campaigns around that. What has that experience been like for you as somebody not only within the Muslim community, but actually providing research in this area, in as to how you've engaged with perhaps some of those services, or why you set up your own platform?
So this is sort of like, where do you start for me? So Myriad work has been running since 2006, and my work around communication has always been, it's almost like a chicken and egg. That do you have the information in place for people to be able to make informed choices, or do you have services that people can access? You can have information but no services, or culturally inappropriate services, so we can have the best will in the world but the services aren't appropriate. Or you can have services where we don't have enough information, or people can't access that information, so people are not using the services. So we came from a stance of a little bit of thinking outside the box. Thinking outside the box for us is this. Look, when we look at, for example, the Muslim community, it's a bit like the term BAME. Who does it define? So the Muslim could be a black man from South America, South Africa, through to northern China, and everywhere in between. So when we look at communities, I think it's really important that we're able to understand some of the community dynamics. So, for instance, and it's great hearing what Louise just talked about, how they've engaged with the mosque community, but within the Muslim community, we might talk about, oh, that's the Bengali mosque, that's the Pakistani mosque, that's the Turkish mosque. So that in itself has barriers and facilitators. Facilitators in terms of the tentacles that can reach out into the community, they can publicize the work, so the mosque can become a hub from within. You can signpost and connect. But actually, the barriers might be that if you don't understand the politics of community organizations, as an organization, you might feel that you're reaching out, but actually it's making very little impact on the wider setup. Then we have to think about things like education and literacy. So, for example, the Pakistani Punjabi community. Punjabi for the Pakistani community is a spoken language, not a written language. So if that community is going to ask for information, it's probably going to ask for it in Urdu. Urdu is a national language of Pakistan. But to ask that, Mrs. Begum, who might be of a Mirpuri or Punjabi background, may not be able to read Urdu, but her kids might prefer it in English, because then they will talk to her mum. They will talk to their mum in Punjabi, but they have access to information in English. So even communication becomes quite complicated. Then on top of that, you're thinking of things like social constructs. So between the different generations, our views around what does it mean to be a carer, how do we identify ourselves as, am I a carer, am I a son, am I a husband, am I a wife, those kind of conversations. And some of these are pertinent to the wider community as well. So carers may not see themselves as carers. However, if we have a religious kind of expectation and obligation that I have a duty to care for my parents, does that duty to care for my parents mean that even if though I'm not able to be a good carer or to access service or support, it's my duty to care? Or does the good carer mean that I should access external services because that supports me to care for my mum or my grandma? So there's lots of those kind of issues. And then within that, we have, again, transitions in terms of how our different generations think of things differently. But gender roles. So at one point, we'd all have this expectation that, and you know, the white British community has passed through this as well, that the women would stay at home, they're the, you know, carers at home, the cooking, the cleaning, the caring, the men are out working. Well, actually, now we live in, and the diverse Muslim population that we have in Britain, if you look at the UK Muslim population, you know, that kind of intersectionality across, if you think of things like our gender affects things, our economic status, you know, our literacy levels, you know, how migrant communities might have faced discrimination and prejudice. So if you get into the stage of dementia, earlier stages of dementia, you might not want to talk to social services. You might not want to talk to the police or the hospital because you may have had some negative experiences earlier on. So for us, if I'm honest, we kind of take the view that many of the people that are seen as community leaders are actually community gatekeepers. So if somebody like Louise was to come to me and say, oh, you're the expert on this, I might feel quite flattered that you think I'm an expert, but actually I could also be a gatekeeper by saying, well, actually, you don't want to go and talk to this group. You don't want to talk to that group. You come to us and we will facilitate, we will engage. And those are some of the politics that actually are real barriers in communities. We also have some work to do with communities where we think that information and education is really important. And I'm sure, you know, in a second, Halda will talk about it from a counselling perspective. But for a very long time, many people in Muslim communities were saying that, look, I trust in God, I leave it to God. You know, what's this rubbish of going to counselling? You know, we wouldn't even recognise depression. You know, cancer was the big C word. And I think at the moment, dementia is a big D word, that people don't see it. COVID impact has meant that families are struggling with other issues, other health concerns. So dementia care is lower down the priority list. And part of the PhD really, for me, has been that it's more than just saying, why aren't these communities accessing services? Or secondly, why is there an increase in, you know, we know that because of population demographics, you know, it's going to be a 7 to 8-fold increase in sort of 20, 30 years. We know that people want to access services. For us, there's a bit of a mixed match between get the information right, some of it in community languages, some of it in English. Some of it has to be spoken format, so roadshows, workshops, going and talking to people, but there has to be buy-in by imams and mosques. Some are really, you know, welcoming, open doors, come and talk. And the others are, well, actually, we're more bothered about, you know, the kind of the practices within the masjid rather than, you know, things like dementia care, because people can go to other organizations. So it's about how do we bring it all together? And there are fantastic examples, maybe we'll talk about in a little bit, of where we can make a difference by some of that thinking outside the box.
Absolutely. And I mean, it is very much that cultural shift, right, in how our communities also, and also the various services really attend to this. And like you said, it's a growing problem, a growing area of concern. But what's really interesting, especially about what you spoke about, the different access points and just how accessible these different informations but understanding can certainly be to aid those communities. And we've got certainly lots of barriers, both in terms of, you know, the challenges and the barriers that we face in the system and the overall kind of way that we access these services, but certainly even within the Muslim community, and engaging with those key gatekeepers, with the mosques and other community centres and hubs, in being able to really create those safe spaces for these discussions, and to really be able to highlight just how much of a growing issue this might be. And it's not just, of course, confined to Alzheimer's dementia. It's across various different health issues. And I think, you know, we have a long way to go as a community to certainly address that. But I think often in that discussion, in that narrative, in that conversation, we lose sight of the kind of family unit and also the elderly in many ways as well. So it's incredibly important, certainly, to see that, and great that you've got these resources there. Now, Khalid, obviously, as a practitioner, and as somebody who's also been a carer of someone to dementia, what have your insights and experiences been? And actually, if I can also ask you perhaps to, you know, speak about some of your experiences in terms of, your husband's obviously an imam, and this is some of the work that you've been doing obviously through the Muslim community. You know, if you can perhaps share some of your own observations and experiences.
Well, I agree with everything that both Louise and Mohammed have shared so far. Very much it is important to utilise the mosques and the khutbah, and not so much with Alzheimer's and dementia, but my husband, as you've mentioned, is an imam and a khatib, and he does sort of use that space to talk about mental health and other various health issues, and issues that obviously affect both the community and the wider community. So I think it is really important to utilise what resources we have, what capacities we have in terms of getting information out there. As you said, I'm a carer myself to someone with dementia, so my mother has dementia, and we found out early on, thankfully, because I noticed myself that she was repeating things. And so it's really useful to have that diagnosis early, because she's had the medication, as Louise was mentioning earlier, which has helped support and settle her. And also having a routine helps. So utilising the mosques, utilising community centres, places that our loved ones would usually use. So if they're fathers, they would be sort of regularly at the mosques and things. And so if we could find ways to ensure that their schedules and their routines are maintained somehow, so that would be wonderful. I think that would help our sort of slow the progress of the disorder, the disease. The other things that help, so I used to work with Age UK. It was Age Concern Camden, and actually it was working with people with sort of an early diagnosis of dementia, and what supported them was having that regular somebody to speak to once a week, anchoring them, so recognizing that, but having it in your own language really helps, because as we know, one of the things that is lost is the ability to speak different languages, especially if they're not your first language. So so English is probably the first to go in terms of vocabulary and communication. And so having mother tongue workers, staff, counsellors really does help that. And carers, both carers and counsellors and befrienders, I'm just aware that really helps. Because with my mum in particular, I noticed that the carers that didn't speak Bengali, she had a more difficult time, was quieter and wasn't sort of interacting with them. So just aware of the various things that can come up, but I think it's really, really important that we recognize that it is really important to utilize the community, utilize what we have out there in terms of resources to support each other. And what's really important, as I think I was touched on earlier, is recognizing that if you are a carer, and as Mohammed was saying, sometimes we don't want to define ourselves as carers, but you can be a carer even as a mother. I know for myself that sometimes I need a break, and it's really important to get that respite for people. So if you know people within the community that are carers, I think it's really important to create that space where they can have respite as well. So, and them knowing that where they can go for that respite and support, because not everybody has like a huge family to lean on. So it might be a single person who's caring for that elderly person.
Thank you. Now, you touched on the fact that, you worked with different organisations, Age UK, Mind, and of course through your own private practice, etc. I mean, what has that transition been like, but also the insights and experiences across these different services? Because of course they do have different objectives and different areas of focus, and perhaps even different geographical locations, working with different communities, etc. But obviously, with this kind of thread, looking at this as a practitioner, working closely with Muslim communities and creating that Muslim community engagement, what has your experience been like working with the different organizations, and really, what certain, I guess, learnings can we take from that?
Well, I guess people that come to you, because I worked, as you're saying, across various organizations. And so, for instance, in a domestic violence organization, I've come across carers of people with Alzheimer's, and they might have found out for the first time. And so the space might be used then to talk about that. And often what I've heard from clients whose parents have had a diagnosis is that actually they're processing a loss whilst the person is still alive, and then they will have to go through another loss when they actually lose the person physically. And so just being aware of these things, I think, is important for practitioners, counsellors who might work with these clients, as well as other people. So, recognising that what the person who's caring for the individual has to go through, as well as the person who's being cared for is going through. I think that's really important to recognise that as practitioners across the board. But really having that presence of people who are, that match, that ethnic match, that language match, that faith match, really does support people. I've noticed that when people recognise that I'm Muslim and they're Muslim, they can talk about things that they wouldn't talk about otherwise with other practitioners. So it's really important to have that match in terms of, as I said, language, in terms of faith, in terms of community. So just aware of that across the board, that whoever you're working with, I mean, I'm just thinking about that back with mind, with Age UK, that actually that was a specific service that was set up, and so they would take on workers that were from various communities. So we had Bengali speaking, we had Urdu speaking, we had Somali speaking practitioners, and so that's really important to recognise and know what your community requires. And it's not just a homogenous group, so that's really important.
Sure, thank you. And if I can ask you all, I mean, what suggestions and recommendations would you give to local or national support services seeking to engage with Muslim communities to increase that uptake of their service of unrepresented, and underrepresented communities? What has that impact been like for some of you? I know that Louise, you've talked about some of the services that you've been leading on in your own organisation, and so perhaps some of the others can also talk about other examples of best practice, and how are you really able to measure that success? If I could start with Mohammed.
So again, I think for us, one of the first things to acknowledge is that we don't always have the right answers, and we don't always know how best to proceed. And that, I think, for me, is being humble enough to know that we need to engage and connect and talk to learn. So things like bias and prejudice, these things can only be broken down if we have that humility to say that we haven't always got things right. We don't always have answers. I often quote this example where, I've had practitioners in the past that have said, well, if I go into a Muslim household and it's the woman there, do I shake her hand? And I said, well, if she sticks her hand out, shake it. And if she doesn't, you don't need to worry about it. So some of these things can be quite common sense approach. But I think my view would be this, that if you're in a position to help make a difference, then think about that person. So when we talk about person-centered approaches and we put the individual at the heart of things, sometimes it's about relationship-centered or family-centered approaches. Who in that family might make that decision? So when we say, Mr. Khan that is living with dementia, we need to focus on the support for what Mr. Khan needs, and he's best placed to tell us what he needs. Actually, families might be making decisions for him. We talk about things like independence for older people, to encourage them to be active and, mentally, physically, to be doing things. In many of the Muslim world, we have this culture that, as you get older, you sit there and, you kind of become a bit of a couch potato, or TV's on, or you read your prayers and you can sit there and, have your tasbih to do your zikr on. However, we need to be quite proactive to look at, as a community, what's the impact on us, but also to look at how best do I access the services that are available to me. We've just heard, and quite rightly so, that if we have people who look like us, talk like us, sound like us, we are better able to connect. Why? Because I think it's human nature that, somebody of a similar background is more likely to understand me. Now, that does not mean for a second that somebody different can't provide you an excellent service, but I think human nature is that we might have our own worries. How does stress was mentioned earlier on? I think Louise might have mentioned stress. But what is the stress from within the family, the extended family? What is the stress from the neighbours and the community? If you decide that you need a break, and of course we also encourage that carers should get a break. So if you decide that you're going to use respite, and if your neighbours or wider family are going to start saying that, oh, actually they've put the mum in care, you can see that family is not going to go back to them. But if the service provider says care through respite is available, but doesn't understand what might be happening for the family, you can't connect. So it might be back to things like understanding the family needs. You might say, well, actually, time out or sit-in service might need to change. So rather than, and I heard this example in the past, we can offer 6 hours a week during the day. And many people say, well, actually, I can have a family member or a neighbour come during the day. It's a nighttime we struggle with. So perhaps services can change. If we think about masjids, not everybody goes to the masjid. Not everyone in the masjid will understand things like the symptoms and behaviours associated with dementia. So if, Grandad Khan walks into a masjid and is disruptive, how does the congregation relate to them? Does the imam, and not everybody's going to be as lucky as your husband's instance, that they can talk about lots of different things. We have to, I think, first thing, empower ourselves with information and knowledge. We have to work with service providers so that it's not a little bit of a us and them, it's that we're all on the same side. I give you a little example that if you've got home care workers that go into a home to provide personal care, well, actually family carers that might be providing personal care, chances are won't have had that training how to do, moving and handling. If there are issues about swallowing and somebody's got dementia, well, does the carer have they had access to training on how to perhaps blend your chapati and curry and feed them that? We might not never have had that concept of you can blend that food. So I go back to that thinking outside the box. What is it that we can do to work with organizations? There was a piece of work I was doing with Alzheimer's Society. I picked it up through some work we were doing in a conference in Europe, and that was about faith communities. And my question to them was, and I still remember it, is that if it's a congregation of the Hindus, the Sikhs, the Jews, the Muslims that come together and we want to produce some information, what is the buy-in by those communities? We have to make sure that those communities are accepting of what we're producing. And that led to some other pieces of work that then went on to actually how do we develop and design, and actually have a meeting coming up, which is looking at how do we redesign information for the public that we can relate to. So there has to be images that look like us. So it's not just about the written word. Okay, I mean, there's lots that we can talk about, but in essence, I think some things that we do in-house, so the Muslim community needs to educate itself, and we're all sorts of different ethnic backgrounds. But I think for services not to think that if they put their hand up and say, I don't know, that it's a failure, it's not a failure. That is actually quite welcoming to say we want to work with each other, we want to learn together. And therefore, if we co-produce something, it's going to be effective for the organisation and meaningful for the communities.
That's really helpful. Thank you. I mean, Louise, if I can bring you in here, obviously as a service provider, and I know that you have made that conscious kind of step and effort really to engage with your local communities. I mean, with everything Mohammed is saying, how does that kind of really tie into some of your own organization's objectives and approaches, and how you intend to engage further with the Muslim community?
Yes, absolutely, it did. It was extremely interesting to hear, because things that he was saying, so for example, around the family, it's even things like, for example, it's not always going to be the case that everyone in the family agrees with how things should go in terms of, whether they should have contact with other organisations, whether things like the sitting service should be put in place. So there have been occasions where I've done some family work, to talk through, to just go over what dementia is, how it can progress, and the importance of looking after the carer as well, or for those caring for those individuals. So I think, that's an important part to understand, that you're not always dealing with families that are united in terms of how their loved one should be looked after and who should be involved in that care. In terms of, things, for example, like the posters. So when I, do BAME events, when I was, for example, working to promote the mosque event, I was very careful to use appropriate materials. So using a poster that was appropriate for that culture, using, making sure there was lots of translated documents, fact sheets in various languages. The Alzheimer's Society now has a designated Punjabi page on their website, which looks at things like signs of dementia to encourage an early diagnosis. There's a checklist that people can just tick, that you can take to a doctor, that would give the idea to the doctor of sort of the various problems and issues that an individual was facing. If you didn't feel you were able to explain that in depth to the doctor. There's also sort of some books like Caring for a Person with Dementia, and a diagnosis as well, looking at moving forward with the diagnosis. So I think, making sure that there is appropriate literature for all communities, so that you can signpost people, so that when you do go into a situation where you're giving information to a family, that you can signpost them to say, well, we've got some fact sheets to follow up or read through after my visit or after our meeting, that you can go over yourselves and discuss maybe as a family the best way forward. I think also in terms of, there can be sort of simple things as well that maybe we need to look at to helping to put and provide additional care. So, for example, many families will say, well, we're not opposed to having community carers coming in, but we really want to have people, understandably, that will talk my mother's language. You know, we'll talk Punjabi, or we'll talk, you know, Urdu. And that isn't easy to find. You know, even if you live in somewhere like Luton with a lot of, you know, BAME communities, South Asian communities, got a very mixed demographics. If I can't signpost people to a particular care agency that would be able to facilitate that. So sometimes that's the stumbling block. And so it's kind of, there is definitely sort of more work to do with being able to signpost people to the relevant support for them that they need, which would, I think, encourage more families taking on that additional support, which can make all the difference to the carers. And in terms of an early diagnosis, just in getting that message out to ensure that people know what the risk factors are. So if, you know, with higher heart disease, higher cholesterol, if you've had strokes, etc., you know, that's all going to increase the possibility of a diagnosis of dementia.
Sure. I mean, we've certainly, you know, really talked a lot about the concept of educating and informing services, which is really crucial in the way that we approach this. But Louise, if you can talk to us more about perhaps the concept of the Dementia Cafe, and again, the importance in being able to create that connectivity, that community, to really help those individuals and families thrive in a way that isn't just about signposting to services and expecting individuals to be quite, I guess, you know, just autonomous and responsible about their own decisions, but actually a way where communities can come together and certainly be able to relive a lot of the things that are familiar to them, and to create that access and connectivity with other members, where those experiences can be shared. Dementia Cafe is really serving the wider objective and agenda around not just raising awareness, but actually supporting those communities within the context of their community.
I think with the Dementia Cafe, as with other groups as well, it's really important for both people with dementia as well as the carers to come together, to be able to just spend time together. It's almost like a self-help, to be able to, you know, it's one thing talking to a health professional about caring for someone with dementia on a day-to-day level. It's another.
Sorry to interrupt you, Louise. Is it just myself who can't hear anything? Is it? The volume's gone. Okay, Louise, just if you could just sort of say your name again, and then once it comes back up, then I'll give you that thumbs up.
Louise.
Yeah, now it's working. There's something that had blocked that. Sorry. So if you could start again with that answer, please.
Okay. I think, you know, the importance of a Dementia Cafe, as well as with other groups, actually, it's the importance of people coming together, whether they be carers or people living with dementia, to be able to just feel that they could be amongst other people who are going through similar issues. You know, the support the carers can have from just being with other carers who are going through a similar situation is immense, which was why COVID was so difficult, because people who really relied on those groups for that support, you know, it's incredibly hard to have those groups taken away. And they missed that interaction. You know, I've seen people coming to groups and they will start a WhatsApp group amongst themselves, you know, in terms of just giving hints or saying, well, this happened, has anyone had this experience, you know, and people then feeding that back. It's incredibly important, because it's one thing to talk to a health professional about, you know, if you're a carer and the issues that you're facing. It's something else to talk to someone, say, for example, from social services about implementing some support like a sitting service or community carers. But I think just for carers to be with other carers, particularly dementia carers being with other dementia carers, it's incredibly, you know, you see it, and it can be very powerful as well. And obviously taking into account to make sure that mix of culture. So we work very hard to encourage volunteers to come forward, so that you can have volunteers from different communities, so that when you have somebody from the South Asian community come to the cafe, they don't just feel that it's, or any group actually, but they don't feel that they're just walking into, you know, a bog standard, you know, one culture. You know, it might not be that. I don't want people to feel that they're walking in and they're the only people from that community, and there's no one there that speaks the language, and there's no documents or fact sheets in their language, and we haven't taken appropriate care, you know, maybe even sort of with the refreshments, you know, to take on board sort of cultural needs. So I think just to be welcoming, just to ensure that you have that support there should that be required, in terms of language issues, and also to sign people to relevant. This is where, particularly with me, the interest was working with the mosque, because sometimes doing home visits, you know, you would say to people, what about who were perhaps reluctant for whatever reason in terms of accepting some outside support? You know, what about looking at support from your own community? You know, what is out there in terms of well-being, and, you know, holistic care. And quite often they weren't really able to give me that answer and say, well, you know, not really, that support, that well-being support isn't there. And so why I really wanted to link up with a mosque was to actually see from, you know, my own perspective, you know, what is actually available. And I understand that there are different communities, different mosques, etc. But I think, you know, for me, actually at that particular mosque, which is the second largest in Luton, I think it's about 40 years old, you know, there was a strong well-being service there, both for men and for women. And I think for that link to be made, which wasn't previously there, now when somebody goes with an issue around dementia, whether it's been diagnosed or not, or caring for someone with dementia, they will now be hopefully signposted to the Alzheimer's Society and to be able to have, you know, dementia specific support or worried about memory loss support, and looking at ways of helping people to care for loved ones with dementia. So it might only be a small step, but the fact that we've never managed that before, you know, I think sort of it is the way forward, and hopefully we've done that once. You know, hopefully our aim is to make that sort of perhaps every quarter, and to link up with some other mosques as well as other communities. Obviously we're looking at all BAME communities, but to make that more of a sort of ongoing well-being, linking it overall to well-being, so that we can just make that connection. It's just, you know, flows more easily, rather for it to be sort of daunting to pick up the phone and to ask for some support from the Alzheimer's Society.
Sure. And Khalid and perhaps even others, have there been other kind of techniques, methodologies, approaches that you've seen that you feel have worked, have been good, or others that you would like to see? And again, particularly Khalid, working in you know, the mental health space and arena, but also working across different communities and age groups as well. It's really important. I mean, a lot of our members at the Muslim Mind Collaborative are organizations that work with young people and with families, and often we don't have the conversations around you know, caring for elderly, and certainly about raising awareness on preventative measures around Alzheimer's and dementia and other health kind of illnesses and disorders. So I mean, from your point of view, as somebody who's obviously been on both as a beneficiary, perhaps a recipient of some of these services, but also in terms of working across various different organizations, have there been other approaches really that you've seen that have worked? Or if not, what could some of those be, and what would your recommendations be?
Well, I would really recommend both for carers and for the person with dementia to be able to access some counselling, and that can be in home visits. With Age UK, we would actually do home visits for the counselling, so people didn't have to always come into the service, so that would make it easier for the person because it would be in their environment. So I think that's one thing that I would really advocate for. I'm just also thinking about some of the things that Mohammed said earlier about really thinking about the whole family and the whole structure and all the carers. I just recall working in schools where the father was elderly and had dementia, and the children were having to do the caring, so quite young children as well. And it was obviously having an impact on some of the other children. And being able to hear that as a therapist in school then allowed me to write something that then helped social services take a step forward so that they could support the family better. So I guess it's really being able to speak to each other. So all the various organisations involved need to be sort of on the lookout and sort of aware of what's going on. Because for instance, with that child in particular, had somebody else not mentioned it to me, I wouldn't have said, oh, we need to sort of do this. So it's really important to communicate with each other as organizations, because that's, I think, generally with mental health as well, it's something that can create sort of that falling through the gap if we're not working collaboratively, if we're not speaking to each other. So finding ways to ensure that we're all speaking to each other, whoever's involved with, whether it's the dementia sufferer or the carer or whoever, it's just really important that we're sort of talking to them about sort of talking to everybody else and being open and honest as they can be, but also creating that space where it's safe to do so, creating the ability for them to communicate. So whether it's with having the sort of match in terms of the pupil being available. So yeah, it's a lot to do, but I think it starts with the education, as I think we've said from the beginning.
Absolutely. Well, thank you, Khalida, and thank you to all our guests. We are running out of time, as much as I'd love to take this conversation forward, but perhaps we'll, Mohammed, I know there's lots of other areas you wanted to explore, but perhaps we'll be able to gain some of those insights through your thesis. So I wanted to thank you all again, and I think it's been incredibly important being able to talk about this. I've been hearing from all of you the importance of really being able to educate, you know, and looking at really all levels in which we can engage, and really great examples of how we've been able to reach out to families, communities, and various different ways of intervention through the Dementia Cafe, through being able to kind of signpost to services, workshops, and really going above and beyond our comfort zone in many ways, right? And what is just the norm on our kind of day-to-day I guess activities and doings within our own organizations, are really thinking about how we can engage with those marginalized communities and those that are, you know, from different backgrounds and cultures and ethnicities, and really thinking about how we can approach them in a way that is relatable to them, so that it's palatable, so that it's acceptable, but also something that is certainly beneficial to the community, and therefore for tackling some of these issues as a whole. So thank you all very much to our guests today.
You have been listening to the Muslim Mind Collaborative podcast. For more information, please visit bcbn.org.uk.